In this unit, we will talk about classical conditioning. We will first talk about different components of conditioning and how we can apply it in everyday life. The understanding of learning dates back to behaviorism. This is the school of psychology that focuses on the measurement of observable behaviors compared to the internal processes. This is the shift of focus from the mind to observable behavior. Researchers here aim to understand how to predict and control human or animal behaviors. Pavlov and Skinner are the pioneers in learning research. Pavlov focused on examining how dogs learn to associate stimuli, and Skinner focused on how positive and negative reinforcement may influence the behavior of rats. Unlike reflexes, such as knee-jerk reflex, learning involves a change in behavior, or the acquisition of knowledge and skills through experience and through nurture. We will talk about three basic forms of learning, which is classical conditioning, operant conditioning, or also called instrumental conditioning, and then another form of learning that involves the social presence of others called observational learning. This is quite different from classical and operant conditioning, and you will see that it involves both unconscious and conscious processing. Classical conditioning is one of the fundamental ways we learn about the world. It helps explain why we hate the sound of our morning alarm, or why we are anxious about an upcoming exam. So organisms will learn to associate events or stimuli that always happen together. In Pavlov's study on classical conditioning, he found that dogs are more able to associate the bell with food after repetition. Here is Pavlov's study. So they rang a bell, or in this picture, blew a whistle, which is a conditioned stimulus, and gave the dog some food. Then after repeating this over several times, when the dog hears the whistle, it will salivate in expecting the food to come. Let's walk through the different components in classical conditioning. The unconditioned stimulus is a stimulus that will produce a response without any training, like the dog food. The unconditioned response is the one that is automatic, reflexive, and unlearned, so a response will occur without any training. So this will be the dog seeing the food and will produce salivation. The conditioned stimulus is a stimulus that does not elicit a response at first, but will do so after some repetition over time. So this may be the new stimuli like the whistle sound. And finally, the conditioned response will be elicited by the conditioned stimulus after repeated practice with unconditioned stimuli. So bringing the food and the whistle sound at the same time will eventually lead to salivation when only with the presence of the whistle sound. Let's welcome our class TA Giggy to do a demonstration. Hello! So Giggy loves banana, so we will use the banana as our unconditioned stimulus for our demonstration. Giggy will automatically dance when he sees the banana. So dancing after seeing the banana would be our unconditioned response. But if I want to train Giggy to also dance when hearing a banana song, I will need to show the banana and then play the banana song at the same time. And after repetition, when I remove the banana, I want to train Giggy to also dance, but only with the banana song. So dancing without the banana would be the ultimate conditioned response. And that's the whole classical conditioning process. And let's thank Giggy for his demonstration. Bye-bye. Now let's apply this concept to humans. In humans, we do have classical conditioning and eating, and also related to taste aversion conditioning. In this example, we have protein as our unconditioned stimulus, and our unconditioned response would be to crave for more protein. So this is based on the evolutionary perspective. And after we learn that meat have high levels of protein, our conditioned response is to crave for meat. Then let's talk about taste aversion. So flavors associated with illness are more likely to become avoided. So this is the conditioned response. And learned aversion occurs more often with new foods. So this can be applied to radiation and chemotherapy. So drugs used in this type of therapy often make patients feel sick. As a consequence, patients often acquire aversion to foods that were eaten just before therapy. And based on the fact that learned aversion occurs more often with new foods, it is recommended that patients could eat a weird or novel flavored candy before the therapy, so it can prevent the formation of learned aversion to familiar and maybe more nutritious foods that they should take. Classical conditioning can also be applied in business contexts. Let's dissect this advertisement. Not sure whether you are a fan of IU, so the photo here would be the unconditioned stimulus. And our automatic response would be a pleasant response, like falling in love with IU. From the salesman's perspective, the highlight of this advertisement would be the cosmetic product. And after exposing to this advertisement for multiple times, the conditioned response is to see the product and then create a pleasant response, and then increase your buying behavior. In class, I show students this pop quiz instructions page, and automatically, most students felt quite stressed about this. In fact, it was just a joke about the quiz. So the highlight of this slide is to demonstrate an example of conditioned emotional response. So this example demonstrates that emotions are also affected by classical conditioning. So not just behavior, physiology, or also in advertisement settings, but emotions can also be trained this way. Classical conditioning can also create conditioned fear responses. The central nucleus of the amygdala is involved in fear conditioning. And phobias is the irrational fear of things, can be considered a form of conditioned response. Let's look at the little Albert experiment as an example. So initially, the neutral stimulus, which is the right red, doesn't create any response in the baby. But after we paired with panic or other emotional trauma, like a loud noise, the baby becomes fearful to the red. So this is an example of how the development of anxiety disorders or phobia may occur. To this point, we've only talked about when and how classical conditioning will occur. This slide presents the concept of blocking. This is when classical conditioning will not occur or is hard to occur. In this example, when there is a strong past experience that the whistle would always lead to food, the association between the second conditioned stimulus, the loud noise from the hammer, wouldn't be associated with the food. The first conditioned stimulus, the whistle, will block the conditioning of the second conditioned stimulus, the loud noise. And the introduction of the hammer will be viewed as irrelevant. What affects the strength of conditioning? Conditioning are more likely to occur when there is some production error or when things go the other way around. So this is why we say that learning depends on a surprise and can reduce the chances of blocking. Second, classical conditioning is strongest when both the conditioned stimulus and the unconditioned stimulus are intense or new. And that's why we suggest cancer patients to take a new flavored candy before chemotherapy. And finally, evolution. Evolution can also influence the strength of conditioning, just like taste aversion. We are naturally inclined to associate an illness with a food, because if there is a particular food that makes us ill, associating the food with the illness will ensure that we avoid that food in the future and avoid getting sick in the future. This sorting tendency is set up by evolution, and we call it preparedness. Finally, let's learn how to erase the learned responses. This is called extinction. Classical conditioning can be undone using the reverse method. So the response to the conditioned stimuli can be removed if the conditioned stimuli is presented repeatedly without the original unconditioned stimuli. For example, clinical psychologists may use therapies to remove unwanted behaviors or thoughts, such as treating phobia. If a person who are fearful of spiders can be exposed to spiders without a traumatic unconditioned stimuli, repeated exposure to it without the stimuli will cause extinction of the conditioned fearful response to the spider. After extinction, there is a possibility of a recovery of conditioned response. And in psychological disorders, we may call it relapse. Spontaneous recovery is when, after extinction has occurred, the presence of the conditioned stimuli will evoke a conditioned response again. So here in this example, hearing the bell or the whistle will cause the dog to salivate again. And renewal effect is when, after extinction, when the conditioned stimuli is tested in a new context or in a different room or presented with a slightly different sound, it will cause the conditioned response to come back. And here in this example, hearing the bell or the whistle shouldn't produce a response after extinction. But after some time, hearing birds chirping cause the dog to salivate. So this is an example of renewal effect. And that's why we say it's more harder to change a habit than to acquire a new habit, because things cannot be unlearned directly. In our next video, we will talk about another form of learning process called instrumental or operant conditioning. And I will see you in the next video.